Hi, I'm Dr. Binyamin Rothstein, and I'm Fred. Today we're talking about why the pain won't go away, in particular, carpal tunnel syndrome. Fred, can I borrow your hand? Sure. The carpal tunnel syndrome means that you experience numbness, tingling, pain, or even weakness in the fingers of your hand, the thumb, index finger, and the middle finger. This comes as a result, we thought, because it's due to overuse of the wrist. For instance, typing, mousing, needlework, construction work, using your hand too much. We thought that it was causing an irritation to the carpal tunnel. Now the carpal tunnel is made up by the bones of the wrist bones here. You see it forms like a little dish form here, a little bowl, and there's a ligament that goes across this. You have a tunnel here under that spot. And that little tunnel contains within it the median nerve. And that nerve supplies the thumb, index finger, and the middle finger. And when the area inside that tunnel gets inflamed, overused, irritated, whatever goes on inside, it affects that nerve, pinches it, and then you feel numbness, tingling, weakness, and it bothers your hand. You can't use your hand like you want to. So traditionally, doctors thought, well, let's treat the carpal tunnel. We'll just do an injection to the spot, maybe do surgery and cut the carpal tunnel open, get the pressure off the nerve, and all is well. And indeed, it does work. Sometimes. The problem is it tends to recur. In addition to that, we try doing exercises, stretching the hand this way, that way, this way, that way, all kinds of treatments to get the pressure off that nerve to leave your fingers alone so you can function more normally. Well, we found out over the years it works sometimes, and rarely does it fix the problem on a long-term basis. And that's because the carpal tunnel syndrome is not really due to a problem in the carpal tunnel. It just looks that way. So you have this problems, muscles going into the forearm, the upper arm, but the real issue in the carpal tunnel syndrome is over here in the back of the neck. You see, these are nerves that come out of the neck. These nerves supply the whole arm and the upper back and the shoulder. And nerves over here are pinched. Then you have pain and symptoms shooting down your arm and even into your hand. And how do these nerves get pinched? Well, sometimes the muscles of the neck are weak, or perhaps they're over tight, they're too tight, they're spasmed, and the muscle spasms grab that nerve and irritate it, shooting pain into the arm and the hand, even the upper back, and so forth. And so what we found over the years is by treating the neck and the upper back, and strengthening the muscles, relaxing the muscles, balancing the body, and sometimes giving nutrition, these symptoms all go away and they stay away. Part of the beauty of treating it this way is that you're not involving me anymore with unnecessary surgery, injections, steroids. You're treating the source, the root of the problem. You're giving the person, you're going to feel better, not just less symptomatic. It's a big distinction between feeling better and less symptomatic. Symptoms are what you feel, but better. Your whole health improves. Your balance improves. Your neck improves. You even think more comfortably because the pain and tension are out of the area. So my practice, what we do now is I treat the whole body, especially the neck and upper back, and then give you exercises. And after a few treatments, the stuff goes away. Your arm feels better, hand feels better, and if you get a problem again, exercises get you feeling good within a short period of time. And I'll tell you the interesting thing people oftentimes complain about is the pain and numbness and tingling that wakes them from sleep. You're lying in bed, you're sleeping, and your hand starts tingling, gets numb, and it wakes you from sleep, and you can't fall back asleep because you're so uncomfortable. Once again, these treatments, this approach takes away those symptoms. It's because when treating the body as a whole unit, everything gets better. You'll sleep better, you'll feel better, you'll think better. Anyway, so if you're suffering from carpal tunnel syndrome, please give me a call at 610-664-1391 or log on to integrativepaintreatmentcenter.com. I'm Dr. Rothstein. I'm Fred. Have a great day and wishing the best in health and happiness.